You told me the other time that you have cough.
Yes, sir.
And some slight fever.
Yes, sir.
Yeah, how did it start, please?
Started like 4 days ago.
Okay. I think you mentioned something about difficulty in breathing.
Yes.
Yeah. Is anybody in the family with asthma?
Not at all.
And none of your relations?
No.
Because I remember the other time you told me that you find it easy to breathe in, and when you are breathing out, it's a bit difficult. Yeah. All this that you have just told me sounds like asthma. And this thing has been on since you were a baby or just started?
I noticed, the first time I noticed was about last year.
Last year?
Yes.
Maybe you reacted to something. You are reacting to pains or fumes or smoke in your environment.
Anytime I fry things like meat or anything frying, I always have difficulty in breathing.
Okay. From what I've heard now, we are pointing towards asthma. Asthma is a disease of the respiratory system. When I mean saying respiratory system, I mean the breathing apparatus, the lungs, the trachea, in which so a patient finds it easy to breathe in, and when to breathe out, he or she finds it difficult to breathe out. And it's usually provoked by external factors such as smoke, fumes, or reaction to certain antigens. And when it happens like that, it tends to run in families. That's why I asked you the other time if there's anybody in your family that has it. But not to worry, there's a way to go about it. And what the pathology is such that you find it easy to inhale and to exhale is difficult. And to the extent that when we doctors come to examine the patient, we hear something we call bronchial respiration. It sounds that's asthmatic, that's asthma. And how do we manage it? First, we need to identify the cause of the asthma, which may be, like you said, it may be fumes, it may be as a result of smoke, it may be paint, it may be a change of environment. A lot of causes can be responsible. And how do we treat this asthma? First thing, we try to remove the causative agent. When we remove it, then we can add something like some drugs. We can use a smooth muscle relaxer, like Ventolin. Ventolin will relax the muscle of the lungs, of the bronchi, so that when the patient inhales, as the patient is exhaling, it becomes easier and there will be no noise. When you do that, it becomes easy for the patient and for the doctor. And since you know now that there is asthma, you should try as much as possible to avoid the causative organisms. Not to worry. In emergency cases, when the asthma is not treated on time, the patient can be admitted and we can administer something we call aminophylline. We can administer it through the vessel, through the